have been attending ASH for more than 30 years, except for September 11th. And it's been very inspiring. And this year it has not betrayed me as usual. And we have come to notice that immunotherapy and immunological basis of hematological cancers is becoming more and more important, apart from the cellular therapies and the new bites and new molecules that also harness the immune response against cancer. One of the different approaches that is inspiring for me is the attempt to introduce sequential approach. In the relapse setting, we have seen oral abstracts. One was from the Spanish group presented by Maria Mateos, and they started using carfilzomib cyclophosphamide dexamethasone for patients who are already refractory to lenalidomide. And so this approach tries to replace the KRD Aspire type of regimen. And if a sufficient response was not achieved, they added POM on top of this regimen, and they were able to rescue 50% of patients. And so a sequential approach was beneficial in their study. Another similar approach was presented by the Canadian myeloma group, and they started with this time with daratumumab and with daratumumab cyclophosphamide dexamethasone, which is a very synergistic approach. And depending on the response and progression, they added this time again pomalidomide in the following steps, and they were able to increase their responses. So this type of sequential approach may be replicated in the frontline setting. And there is now a new study which is going to start, which is named EQUATE in the United States. And in non-transplant eligible patient groups, they are going to start with Dara-RD, which is a very strong regimen. And checking for the MRD status, they are going to randomize patients to continue treatment with or without an anthracycline bortezomib. So this will question, does all patients require quadruplet from the beginning, or shall we be confined with the triple regimen depending on the depth of response? The sequential therapy certainly now is going to integrate the depth of response and minimal residual disease, which has been discussed in detail during the ASH meeting, is a very important concept. And here we must also acknowledge the master study, which was presented earlier this year in ASCO and also during EHA. And it's been updated again here. And in the master study, and the MRD achievement may be leading in the following steps of treatment and even stopping treatment. So these are important studies that must be kept under eyesight for future.